Hello guys, welcome to NextMeds. Let's dive into today's video. What is gastritis? Let us find out. Watch the video until the end to get a good knowledge about gastritis. Acute gastritis refers to the sudden inflammation of the lining of the stomach. This condition can be caused by various factors such as excessive alcohol consumption, prolonged use of non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin or ibuprofen, bacterial or viral infections, such as Helicobacter pylori or norovirus, stress, or ingestion of corrosive substances. Let's understand pathophysiology. The pathophysiology of acute gastritis involves irritation or damage to the gastric mucosa, which leads to inflammation. This damage can disrupt the protective barrier of the stomach lining, allowing stomach acid to come into contact with the delicate mucosal layer. As a result, inflammatory mediators are released, triggering an inflammatory response characterized by increased blood flow to the affected area and the recruitment of immune cells. The symptoms of acute gastritis can vary depending on the underlying cause and the severity of inflammation. Common symptoms include abdominal pain or discomfort, often in the upper abdomen, nausea and vomiting, loss of appetite, bloating or feeling full quickly after eating, indigestion, dark tarry stools. Common causes of gastritis. Helicobacter pylori infection. This bacterium is one of the most common causes of gastritis. It can infect the lining of the stomach and cause inflammation, leading to acute or chronic gastritis. H. pylori infection is usually acquired during childhood and can persist for many years if left untreated. Medications. Regular use of certain medications, particularly non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, and naproxen, can irritate the stomach lining and increase the risk of gastritis. Other medications, such as corticosteroids, bisphosphonates, and potassium supplements, can also cause gastritis as a side effect. Alcohol. Excessive alcohol consumption can irritate the stomach lining and lead to acute gastritis. Chronic alcohol abuse can also increase the risk of developing chronic gastritis and other gastrointestinal problems. Stress. While acute stress itself may not directly cause gastritis, it can exacerbate existing gastritis symptoms and increase susceptibility to other contributing factors such as H. pylori infection or NSAID use. Chemical irritants. Ingestion of corrosive substances, such as strong acids or alkalis, can damage the stomach lining and cause acute gastritis. This can occur accidentally or intentionally. Autoimmune diseases. Conditions such as autoimmune gastritis, where the immune system mistakenly attacks the cells in the stomach lining, can lead to chronic gastritis and impair the production of intrinsic factors, which are necessary for vitamin B12 absorption. Diagnosis. Diagnosing acute gastritis typically involves a combination of medical history, physical examination, and diagnostic tests. Your healthcare provider may inquire about your symptoms, dietary habits, medication use, and any recent illnesses or exposures to potential irritants. Diagnostic tests may include blood tests to check for signs of infection or anemia, stool tests to detect the presence of blood or infectious agents, upper GI endoscopy to directly visualize the stomach lining and obtain biopsy samples for analysis. Imaging studies such as an abdominal ultrasound or CT scan may be performed if complications such as perforation or abscess are suspected. Treatment. Treatment of acute gastritis aims to relieve symptoms, promote healing of the gastric mucosa, and address the underlying cause if identified. Common treatment approaches include avoiding irritants such as alcohol, NSAIDs, and spicy or acidic foods, medications such as antacids, proton pump inhibitors, PPIs, or histamine 2, H2, receptor antagonists to reduce stomach acid production and relieve symptoms. Antibiotics to eradicate bacterial infections such as H. pylori, if present. Antiemetics to control nausea and vomiting. Dietary modifications such as consuming bland foods and avoiding large meals. Adequate hydration. In severe cases with complications such as bleeding or perforation, hospitalization and supportive care may be necessary, including intravenous fluids, blood transfusions, and possibly surgical intervention. Overall, the prognosis for acute gastritis is generally good with appropriate treatment and lifestyle modifications. However, it's essential to follow up with your healthcare provider for monitoring and management of any underlying conditions to prevent recurrence or complications. Thank you and subscribe for more videos. Stay tuned with NextMeds for daily videos about health, lifestyles, and common disease conditions.